Good morning, everybody. Hello, batch 22. I hope you are all in good health and safety and stay at home for your safety. For this morning, we have these lectures on quality assurance from community dentistry. For the learning outcomes of this quality assurance, we expected you to have explained one's own perspective of quality, apply the process of assuring quality of oral healthcare delivery. Okay. What do you mean by quality, or how do you going to say it? Is the quality of treatment in PIDC good? Who is supposed to assess this statement on you? Is that you as an operator or as a student, or is it the lecturer who supervise your work? Or is it the patient who is receiving your care? So what do you mean by quality of treatment? Right. So we will go step by step to understand what you mean by this, right? By quality. Okay. So for today, my content of presentation will be what is quality and quality assurance, dimensions of quality, the need for quality, and quality measurement framework and process. Okay. For introduction, a little definition on quality. The totality of features and characteristics of a product or service that bear on its ability to satisfy stated or implied needs. A product or service has good quality when it complies with the requirements specified by the clients. Okay. And third one, delivery of reliable information services within an agreed span of time under agreed conditions at agreed cost and with necessary aftercare. Okay. Philosophy of quality by Maxwell. One is by Maxwell dimensions of quality. Okay. What is quality? Have to be accessibility, equity, appropriateness, effectiveness, efficiency, and social acceptability. But the DONABEDIAN approach very simple. It consists of three things: the structure, the process, and the outcome. Dimensions of quality in healthcare. From effectiveness. What do you mean by effectiveness? They have to be when you are providing care, providing care process and achieving outcomes are supported by scientific evidence. Okay, effectiveness. Efficiency, maximizing quality of a comparable unit of healthcare delivered or unit of health benefit achieved for a given unit of healthcare resources used. Efficiency. Equity. Providing healthcare of equal quality to those who may differ in personal characteristics other than their clinical conditions or preferences for care. Alright. And patient-centered. Meeting patients' needs and preferences and providing educational support. Safety. preventing actual or potential bodily harm. Timeliness, providing the needed care while minimizing delays. So, the quality framework by the DONABEDIAN 1966 proposed three categories into which service could be characterized as. Okay, one is structure. The structure involves the personnel, the equipment, the building, the record system, the finance, the supplies, and the facilities. Second comes the process that incorporates all aspects of the performance of activities of care, and the outcome. The third one is the outcome, where it denotes the end results of care or service. All three categories need to be considered to obtain a balance of quality. Traits of quality in a healthcare professionals. From the word care, C-A-R-E. What do you mean by care? Care means you are committed, caring, and communicable. You are accountable, autonomous, approachable. You are reliable, respected, resourceful. You are expert, you are efficient, and you are ethical. This goes a long way into giving services to patients or giving services to patients, yes. So the operator have to be committed, you have to be committed, and you care about the patient, and you can communicate, or you should be communicate with your patient before you give treatment or necessary, whatever is necessary requirements that the patient required. You are accountable, autonomous, and approachable. Whatever is your decisions, you are accountable for it, and you are autonomous. You decided and you make the decision, and you are responsible for it, and it is approachable. You are reliable. You do a good job about it. Respected. Patient respect you for what you have done to them, and resourceful. If you don't, you can get resources from many ways. Okay, and you are expert. Expert, it means you know exactly what you are doing. You are efficient in doing it, and you have a ethical in doing the procedures. Okay, even though at this point of time you are still doing under supervision by your lecturers, by the clinical supervisors, they are actually responsible for what you are doing. Okay. Quality of care equal to technical skill plus the human aspect. Of course, you have to have the technical skill, and you have to have the human aspect, which is very good for you in a long term. You have to communicate with the patient all the time, not only the patient, but with your staff, with your colleague all the time, in order for you to be able to do or to give your technical skills. And you can get these technical skills not only now in the clinic, but also later when you have attended other clinics or other courses. Okay, both technical skills and human aspect can be improved. Quality in healthcare. Carrying out interventions correctly according to pre-established standards and procedures with an aim of satisfying the customers of the health system and maximizing results without generating health risks or unnecessary costs. That is conformance to specifications. Okay. Traits of quality in healthcare services have to be comprehensive, cost-effective, and contractual. Care A is accessible, accredited, and acceptable. R is relevant, reliable, resources, and E is efficient, equitable, and effective. Okay, so how do you mean by health services that is comprehensive, cost-effective, and contractual? They have to be comprehensive. Whatever treatment you give to the patient, it have to satisfy the patients to the best that you can with the equipment that you have, with the resources that you have at that point of time. Yeah, in that situation, in that environment. Okay, accessible treatment must be accessible by all groups of patients, by a group of communities. Okay, by this point of time. Relevance. Efficient, equitable, and effective. Whatever treatment we give to the patient, it have to be relevant to the patient and it have to be efficiently given to the patients. Quality efforts in healthcare. Quality pioneers have different opinions, like Dr. Joseph Duran, the fitness for use, but Philip Crosby, they go for zero defects, but Dr. Edward Deming, never-ending cycle of continuous improvement. So that is a much better quality or philosophy that we can follow. Never-ending cycle of continuous improvements. There's always a ways of to improve the quality, to get a better quality, to assure a better quality services rendered to our patients. 4 approaches of quality. 1. Quality control. 2. Total quality management. 3 is quality assurance. And 4 is continuous quality improvement. 1. Quality control. Quality control in healthcare organization refers to activities that evaluate, monitor, or regulate services rendered to customers. Okay? In a way, we observe, we identify, and we track the procedures. The process, we observe the process, we identify the variable characteristic in the process, and we track the variables through statistical methods. Quality control process. It is an 8-step process for monitoring and evaluating performance. They are: establish control criteria. Uh, this is where our establish control criteria. This is where our ISO procedure can be given as an example. Okay, identify the information relevant to the criteria. Okay, determine ways to collect the information. Okay. Collect and analyze the information. Compare collected information with the established criteria. Make a judgment about quality. Provide information and, if necessary, take corrective action regarding finding to appropriate resource. Determine when there is a need for re-evaluation. Second one is total quality management, TQM, a philosophy developed by Deming and considered the hallmark of Japanese management. Based on the premise that the individual is the focus of production and service, the environment must be customer responsive. Okay? Everyone is subject to continuous improvement efforts. Okay. From the procedure that we have, from the quality that we have in the procedures, there are few things that we can see can be improved in the procedure. That's why we have a total quality management. We look at the management as a whole, as a the total management of the procedures. And everyone that was involved in the procedure is subject to continuous improvement. Total quality management is a way to continuously improve performance at every level of operation in every functional area. We are looking at total quality management, where there is a way to continuously improve performance at every level of operation in every functional area of an organization using all available human and capital resources. Alright? And the aim is to reduce the waste and cost due to poor quality. The example that I can give is maybe the post laju, where they pack and they send the record, and they send the parcel to customers and get the approval, and they get the signature of customer to say that the customer have received their parcels. So there is ways where we can track the parcel. At the beginning, the postgraduate have to record the parcel, and they have to make sure that the parcel is properly packed before they can accept the parcel. Okay. And the second thing, they record the parcel, the time, the weight, or what and the time they receive, and the weight, and the payment that the customer have to pay them for their services. All right. And the third thing, they have to arrange the parcel in their place, and to make sure that they record where the parcel is going to be posted. So it should not be of the wrong address or wrong state or wrong area. Then then they be sending it with their van, with their motorbikes, or whatever means of transport that they have to the specified address. And when the person reach the address of the receiver, they must record that the person have already received their parcel. So within that simple procedure, there's a lot of people involved, a lot of procedures involved, and a lot of uh, quality quality of the services that is required for the person to get the parcel that was sent to him in a good quality, good conditions. Alright, so and the aim of the procedure also is to reduce waste and cost due to poor quality. Alright, three main elements of CQM: the customer. Alright, whose needs are paramount to the determination of quality. Okay, teamwork as a means of achieving quality, scientific approach, decision making based on data collection and analysis. Another example that I can give is the patient came to the clinic that required certain specific management to reduce pain, or to reduce their pain. And then they was referred to the counter. They was referred to the counter, and they have to register, and they have to pay certain amount before they can be seen by the screening officer. The screening officer will have their what do you call? The screening officer will have their quality control. Okay, and then even the counter also, they have their quality control. Okay, and then the screening officer will send the case to whichever clinic that he should refer to according to the need of the patients. Alright, and the receiving clinic will have to take the patient, interview the patient, check the patient, and suggested certain treatment that was required by the patient. And if it's an emergency case, it's a pain relieving treatment, so that is the first thing that the receiving clinic should be doing. So they also have their own procedures with a quality there. So all this teamwork, all this customer teamwork and scientific approach is very necessary in the TQM, Total Quality Management The third one is the quality assurance. All of the activities that make it possible to define standards, okay, to measure the performance of services and health providers, to improve the performance of services and health providers so that care is as effective as possible. Okay, in this quality assurance, you have to have standard in every activities that was that is in the procedure. Every procedure, every quality, every activities have to have a standards. Okay, and that standard have to be can be measured. The standard can be measured. Okay, and to measure the performance of services and health providers, and this is where you can improve the performance of services and the health providers so that care is effective as possible. Alright, that standard will determine whether the health the providers can perform up to the standard or they need or they cannot perform to the standard. Then only we have to look into why and where that they cannot perform to the standard, or where or why or why or where we can improve the standards. Why quality assurance? It provides objective evidence that give client and society confidence that the quality of care within the institutions or healthcare system satisfies stated requirements. This is the level of guarantee. Okay, QA is an integral part of clients' care activities in all health authorities. What does this mean actually? With the QA, with the standard, example, clinic in a community, we want the objective of the clinic, of the standard of the clinic, or the quality assurance of the clinic is that every patient that come and registered in the clinic will be seen within, let's say, 30 minutes by the either the doctors or the nurses, whichever is applicable. Alright, and when they come to the counter will record the time the patient registered with them. And when they were called into the surgery, the person in surgery, the DSA in the surgery will record what time that the doctor or the nurses start seeing the patients. So this has become standard to them, whether they can achieve the 30 minutes that they promise, or they cannot achieve that 30 minutes. With this, they will have to record every patient that come, and this has become their records. Okay, later we will see whether that standard of achievement can be can be achieved, or is not possible for that clinic to be achieved. Then we have considered some changes or to change the standard itself. Okay, so this is the level of guarantee, and QA is an integral part of client care activities in all health authorities. Okay, Quality assurance. Define quality. You have to define the quality. How do you find the quality? Standards. Quality we can define it as standards, the norms or guidelines. They have to be measurable, right? One cannot measure that which one has not defined. If you cannot define what is your quality, then you will not be able to measure it. Okay, so you have to define the quality, get the standard of the norms or the guidelines so that there is a quality that can be measured. So measure quality, the variation in standards. One cannot improve that which one has not measured. If you don't have a measured quality, how are you going to improve on that? You have to have a standard, a quality that can be measured so that you can compare over the time. You can compare and you can improve on the quality that you have. Okay, improve quality, comply with norms. Okay, for this time you may have certain norms, but over the time with improved services, more finance given, more staff given, you should have an improved quality. And what is now is the improved quality. So they have to other than comply with the norms, but the standard have to be higher than the before, than the standard before. So what is the benefit of QA? Quality assurance is a mechanism for assessing the quality of care, okay, and implementing and evaluating changes in the patient care delivery system to maintain or improve the quality of care. So when we can measure the quality, we have assessed the quality, there is a room for improvement with certain changes, okay, or you want to maintain that quality for a certain period of time, so that we can decide that later, right? So what can make you change the quality to higher quality of care, or what, so that there is an improvement in the quality of care, or is it we can only afford to maintain the quality of care that was given at that point of time. The benefits of systemic quality assurance program include documentation of the effectiveness of the educational and patient care program. Okay. Identifications of the areas of the educational and patient care programs that could benefit from improvements. Establishment of a mechanism for ongoing identification of strengths and weaknesses that will support plans for development, revision, improvement, and expansion of educational and patient care program. What is needed to support quality assurance? You have to have a clear, detailed, and accurate records. Okay. You have to need to be maintained on procedures to be followed, action to be taken, and action actually taken. Right? 2. Effective communications. At all levels of organization means that people are well informed. Okay? Training to keep personnel up to date with skills and technical developments. 4th, commitment. Top management needs to be committed so that resources allocated to quality assurance initiatives and actions are followed through. Okay? Clarity. People need to know what they're expected to do. So responsibility for quality activities must be clearly assigned. Why quality assurance is needed in healthcare? One is professional factors. The professional themselves, they have to have codes of conduct. They have to growth of autonomy, accountability, interprofessionalism, and moral issues. Okay. Under economic factors, demographic change, resource distribution. Under social or political factors, you have to have public awareness, or you have social expectations, you have legislations, accreditations, and international pressure and international pressures. Certain countries to have a certain quality assurance so that in a way we are providing a standard care for everybody in the country. Okay, so the quality assurance of one country may differ from the quality assurance of other countries depending on whatever the people needs or whatever the resources or financial status of the country itself. Yeah, a more stable or more better financially countries may have a higher standard of healthcare, higher quality assurance in their healthcare. Okay, but the less economically countries, they may have a lesser or a lower quality healthcare, but it should be involve the whole community, the whole country healthcare system. So, at the basic level, quality assurance incorporates the following stages. Lang, 1984. Setting standards. Alright. Involve writing statements that describe achievable and desirable level of quality of care. These are professionals' expectations of the service and statement of intent of clients. Okay, if you go to existing clinic right now, yeah, they have what they call quality assurance of the clinic on the walls. They write out what the clinic, what are the services that clinic can provide to the patients, and what they expected the patient to have or to get from the clinic, and also what the patient should bring to the clinics. All right. Number 2, appraising actual achievements involve comparing practice with a defined standard through measuring criteria. Appraising actual achievement involves comparing practice with the defined standards through measuring criteria. Of course, as we said before, we have to have record of every procedures or every standard procedures that was in the setting, that was set in the statement. Yeah. Third is planning for improvement. Involves planning for improvements. Any gap between provision and expectation requires actions. That's why we did records for this, so that anything that is not up to the expectation, we have to see where are the loopholes, or who or where are the procedures that is not achievable by the workers. Okay. For taking action when required. If quality is below the stated acceptable level, then action is taken to raise quality until standard meet. Of course, when you cannot meet the standard as we have promised, so the management have to look into this so that they can improve on the certain things that do not achieve the quality, so that we can improve the quality up to the standard. Okay, this is how you can do it. The plan, the personal policies and procedures. We have to plan first. You have the quality principle, you have the factors affecting qualities, you have to plan, you have okay, you have personnel, you have the personnel, you have the policies, and you have the procedures. All right, and then check sample guidelines, error categories. Sample everybody after the training, or that you have to follow the procedures that was set. And there is higher authorities who will check on the guidelines or on the error categories. Okay, and then you have to act. Whoever that you have not achieved the standard procedures or standard quality, okay, they have to be reviewed. The procedures have to be reviewed or have to be revised. That is where you need to communicate and is to monitor the procedure done by the people or by the staff. Right? And any non-achievable, they have to be reviewed and revised. Either you review or revise the procedure, or you review or revise the personnel that is responsible for certain procedures. You may need to give extra you may need to give skills to them, extra training, or you may have to retrain them to to follow the proposed or to follow the procedures, the standard policies and procedures. And then again back we have to plan the quality principles and the factors affecting the quality. We have to review and to redo or to improve the quality. Okay, and then back to personnel, the policies and the procedures. So with that, you have a continuous quality improvement. What is a continuous quality improvement? It is a cyclical process. It involves identifying an area where there is an opportunity for improvements, then outline the sequence of activities that should occur in order to solve that problem and implementing them. Once the cycle is completed, it has to be determined whether the problem has been solved. If the problem continues, the cycle should be repeated. In the first place, we have to identify an area where there is an opportunity for improvement. Alright. Then outline the sequence of activities that should occur in order to solve that problem. And then implementing them. Implementing the new sequence of activities. Once the cycle is completed, it has to be determined whether the problem has been solved. If the problem is solved, then the cycle is complete. Okay, but if the problem is continuous, the cycle should be repeated. Opportunity for improvement. The difference between the actual and the desired state. Standard of performance is defined for measurement using indicators. Okay. Model of quality improvement. What are we trying to accomplish? How will we know that a change is an improvement? What change can we make that will result in improvement? So again, we'll go back to that act, plan, do, and study the results of the improvement, quality improvements. Continuous quality improvement cycle. There are 7 steps involved in implementing continuous quality improvement cycle. Step 1, identify an area where opportunities for improvement exist. Okay. Step 2, define a problem within that area and outline the sequence of activities of the process that should occur in that problem area. Okay. And step 3, establish the desired outcome in the process and the requirements needed to achieve them. For step 4, select specific steps in the process, and for each step, list the factors that prevent the achievement of desired outcome. Step 5, collect and analyze data about the factors that are preventing the management. 5. Collect and analyze data about the factors that are preventing the achievement of the desired outcomes of the desired step. Step 6. Take corrective action to improve the process. Step 7. Step 7. Monitor the results of the action taken. Step 7 will be to monitor the results of the action taken. Benchmarking. Okay. Benchmarking is the best practice research will be the best practice research occurs when an organization identifies a weakness and then goes about identifying the other organizations who excel in that area. The best practice research occurs when an organization identifies a weakness and then goes about identifying other organizations who excel in that area, and to the deficient organization following development then tries to implement best practice. Benchmarking. You have another clinic to benchmark with as you improve your services. Okay, standard or requirements. An agreed level of performance negotiated within available resources, and each standard reflects an element of quality of care provided. So if we are to do the procedures, we have to be very careful with the standards. All right, so that the standard is important for those who provide the services. They have to have a standard kind of services. Each standard reflects an element of quality of care provided. Okay, how quality is judged? How quality is judged? A standard specifies what is important to achieve, specifies levels that have to be achieved, may apply to an activity or feature that is important for quality, may apply to series of activities or a collection of features that are important for quality. Okay. Example, the standard is 95% of clients at clinic are to be seen by the dentist no later than 20 minutes after their scheduled appointment time. Okay. Actual achieved performance is measured against identified quality criteria. This is used to judge whether the standard is being met. Okay. And the findings under QAP, quality assurance performance, shows that 30% of clients with longer than 20 minutes after scheduled appointment, then the standard is not being met. Managers can deal with situation by two ways. One, changes could be implemented in the service to enable the standard to be met. That is what quality improvement is. Or two, it may be decided that the target is unachievable within existing resource availability and the standard may be readjusted. Who set the standards? Actually, who sets the standards? As consumer, MSQA, SIRIM, management, clients, government, practitioner, MOH, accreditation committees, professional bodies, and WHO. Alright, these people can set the standards for services that was rendered to the people in the community. Standards. Every individual who accepts that quality is everyone's business sets personal standards, both in their professional and private roles. The client is on the receiving end of care. Therefore, client's view of the service is very important. Practitioners are involved in setting standards for the care of individual clients. The fourth point is all of these standards must comply with the standards of care specified by the professional bodies that express their agreed codes of conduct and philosophies of healthcare. And the fifth one, local management will set standards that specify local commitment to quality and reflect local needs. Okay. This standard should be within the framework of the standards set by regional healthcare authorities. So, in the Malaysia context of QA, we have quality initiatives in oral healthcare provision by the MOH include clinical practice guidelines. We have the MSISO 9000-2015 Quality Management System. We have patient-centered care. And we have Quality Assurance Program. Under Quality Assurance Programs, QAP, in Oral Health Division, MOH, Malaysia, the QAP is intended to improve the quality, efficiency, and effectiveness of the delivery of health services, including oral health. The QAP also facilitates the planned systematic evaluation of the quality services. The third one, the goal of the QAP is to ensure that Within constraints of the resources available within the MOH, the patient, his family, and the community obtain the optimum achievable benefits from the oral health services. Indicators of QA in Malaysia. Monitoring shall be carried out on a scheduled and regular basis by the State Deputy Director of Health, Oral Health, senior dental officers, and dental nurses. The progress of the planned activities is monitored through indicators as stipulated in the quality assurance program, such as National Indicator Approach, District Specific Approach, Program Agreement, Key Performance Indicators, and National Oral Health Plan Goals. Okay. In 2015, 4 National Indicator Approach (NIA) indicators were monitored to measure the performance of the primary and community oral health services. Read in 2015 as are listed in Table 81. Okay, number 1, the indicator is percentage of primary school children maintaining orally fit status. The standard is more or equal to 65% or less than 65%, less or equal to 65%, and the achievement in 2015 is about 64.8%. So standard in quality is achievable. Number 2, percentage of secondary school children maintaining orally fit status. The standard is more than less than more than 80, more or equal to 80%, but the achievement is 70%. So we do achieve the standard in quality. Number 3, percentage of non-conformance of fluoride level at reticulation points of level less than 0.4 part per million. The standard is less than 25%, less or equal to 25%. Achievement is in 2015, 20.9%. So we do not achieve the standard. Percentage of non-conformance of fluoride level at reticulation point level more than 0.6 part per million. The standard is less than 7%, and our achievement is 0.9%, and no, we do not achieve the standards. Okay, this is a few This is a few referrals that was used for this lecture. There are more reference that you can use for the readings. Okay, that you can use for further readings. All right. So with that, I thank you all for your attentions, and thank you very much. See you again next time. And again, take good care of yourself. Stay healthy, stay good, and stay at home. Thank you very much.